what you do every day.
Yes.
Mm-hmm.
And I think sometimes we underestimate how hard that is for people to change.
I think people know it because they do it all the time themselves. And if I look at myself, you know, if I only look at my diet, it's not going to make any difference. I need to exercise, I need to walk, I need to do all these steps to
so we know that, and we also know we don't like it, and we know it's frustrating.
And so it's frustrating for us, so it's even more frustrating for the D and the cat because whatever I do, they're still fat. Or what you very often hear is the fact like, I hardly feed them anything.
Yeah.
And still.
Yeah. And in some cats.
Sorry for saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
Hi, this is Dr. Susan Little.
And Dr. Yola Kerpenstein.
And we're so happy to have Dr. Adronie Verbrugghe. Did I do that okay? Verbrugghe? Wow, I've been practicing.
Okay.
Verbrugghe.
Oh gosh,
that's right.
Okay, we should get the Dutchman to introduce the Belgian. Yeah. Clearly, it's the wrong person, but regardless, sorry for mangling your name. I did my Canadian best. We're just so happy that we have the chance to have a second chat with you because there's so much to talk about in nutrition and in feline nutrition.
Mm-hmm. So, but then you talked a little bit about DEXA. What does DEXA do?
So DEXA is the gold standard for measuring body composition in humans and animals. DEXA stands for Dual Energy X-ray Absorptiometry. It's how people really know this, I think, is it's a bone scanner, bone densitometer. So women
we're familiar or at some point
in your life
you will be
familiar
right
so we use it for body composition, so it measures total mass as well as fat mass, muscle or lean mass, and then it gives you bone density and bone content as well.
So and last but not least, I stand every day on a scale that estimates my, fat percentage.
Oh, do you?
Do we have that for cats?
No.
Too?
Are they accurate in people? Are they?
They are supposed to be semi-accurate.
So
it fluctuates quite a bit, I have to say.
So what does it give you? It gives you not just weight, but what?
It gives you the percentage of fat.
Does it?
Mm-hmm. Yeah.
That's
and there's been other technologies
algorithm
that
it's using, I assume.
I think so. Yeah. And there's been other like with DEXA, the problem that we have with DEXA, it's still used a lot it's mostly used in research, right? In clinical settings, the equipment is very expensive. So if you want to use that in veterinary practice, there's no veterinary practice that will purchase one of those, right?
And you have to be one very at OVC. Quiet as a patient. You have to lay still.
So we typically do this under sedation in cats and dogs.
Yeah. So it's not an everyday tool.
No.
Which is a little tough when you have morbid obese animals.
Sure.
So you don't want to anesthetize them just for. And it takes a little bit, 40 minutes to do it DEXA?
It depends. If you would scan the whole table, and let's say like a very big dog, like a Great Dane, would fit on the whole table, would be a 30-minute scan.
30.
Okay.
Yeah.
So a cat would be like maybe depending on how sensitive you put
your settings.
Yes.
Right.
But like a 15-minute scan for a cat.
Yeah. But they have to be still for the food. Yeah. So it's a research tool basically, but very helpful, I'm sure, to you. Yeah. Right. As you're working with patients. Now, before we started recording the podcast, you and I were chatting a little bit about the value of obesity clinics. Mm-hmm. Yeah. Yep. So tell us why. What is?
Can I ask you one more question? Although it escaped me right now when we were talking about the DEXA, I think we need to point out how important it is for veterinarians to record the weight every time when they go into the clinic.
Yeah, that is a really good point.
Yes. Yeah. Recording body weight, body condition score, muscle condition score every single time is very important.
Yeah. So it's also be really part of your physical exam, which it is.
And not just that. We have cats that owners bring in to get like their nails trimmed periodically, or their grooming, or their and we'll weigh and record it. Even if it's just weight, just never miss an opportunity.
Yes.
Because weight is such an important indicator also for
health.
Impending
and
disease.
like looking at the WASAVA nutritional assessment guidelines, that first screening evaluation, a lot of veterinarians think it takes extra time in their appointments. Like, how do we fit this into our 15-minute appointments? But you're really not doing that much extra, right? Like you're already doing your physical exam. So if you're feeling full lymph nodes, why not feeling for muscle and fat at the same time, right? So you just go from the head to the tail just once, and you record everything all at the same time.
And I think it's like anything, the more you do it, the better you get at it. It becomes second nature. You don't have to think about it.
Just want to make that point. Now we can go back to the obesity clinic.
Yeah, so this is a very intriguing idea to me. So tell us a little bit, what's an obesity clinic and why do we need to think about them in VetMed?
Yeah, so with an obesity clinic would be a place that focuses specifically on weight loss programs for cats in this case. It would help. I would see this as pet owners bringing in their cats on a regular basis. We could even do something like if the owner doesn't want to take care of it at home, we could organize fat camp or something like that. Right?
I like that.
Having them visit.
Send your cat and we'll do the program.
I think one of the things with obesity programs or weight loss programs is that they're very intensive. Yeah. You have to follow up very regularly with these patients and clients. Yeah. You have to check in with them very, very regularly to make sure that they continue to be on track.
Because they go off track easy.
They go off track very easy. And you want to make sure that you celebrate their successes moving forward. So bringing them into the clinic is very, very important. So I celebrate veterinary practices that have an actual weight loss program in their practice and focus a lot on that. And that can be very technician driven, right?
Yes, sure.
Just bringing in those animals, checking them very often. How an actual weight loss clinic can really help as a referral service, taking some of that very high intensive follow-up away from veterinary practice if they prefer not to do that.
They don't have the time. They don't have the staff.
Yes. At the same time, an obesity clinic could help collect data for research as well.
Yeah, absolutely. Yeah, and I think it gives owners really a focused time. There's no distractions. We're not going to talk about vaccines or anything else, right? It's just focused on the weight.
And especially like even it's not just about the follow-up, also that initial appointment. Just obesity cases can be like just collecting a diet history for an animal that's overweight, going through everything that they're feeding. Usually they're feeding a lot, right? And it's not just the wet food or the kibble. There's so many snacks and table scraps and treats and everything. And you want to address everything. So within our nutrition service, our appointments tend to be an hour and a half just talking about diet.
So there you go, right? And I think that's one reason why a lot of vets in general practice get frustrated with obesity management, right? It's because we might not know about the tools, but also sometimes we can't spend that kind of time, right? And I think we need to manage obesity like its own disease, right? And devote that kind of time and expertise to it.
Yes.
Right? It's really important to get weight off of animals.
So now I'm going to push back a little bit because I think obesity clinics work really well in the D word, but they may not work as well with cats because owners hesitate to bring their cats to the clinic very often.
Just the bringing the cat thing.
So I always thought if you start a good obesity clinic, you probably need to have, for the Ds, they come in, but for the cats, you have to have a service that goes to their home. Yeah,
and we've done that with research projects as well. Like when we were enrolling obese cats in weight loss trials, they would come in for the initial assessment. Or at the times that we needed blood draws. But if it was a weigh-in, we would actually take the baby scale and go to the house.
That makes so much more sense.
Yeah, so it just shows you have to adapt a little bit. But that makes me think of other things. Like, so for the other species, you can get them on treadmills. Yeah, but that's not impossible for cats.
It's not impossible. No, we like at OVC we do have a rehab service, and they have put the cats on the underwater treadmill. So there have been a few cats that have done that. So it is possible. Yes.
So I think we just have to be flexible with cats. I think some cats are quite amenable to visiting the clinic and doing that, and others not so much.
And I think, like in veterinary medicine, we have to treat any animal as an individual, right? And we come up with a treatment plan that works for the animal as an individual, but also for the owner.
Yeah.
So does it fit with their lifestyle, with the animal's personality or character? And
that's a really important point, because if you're treating obesity in a pet, it's a lifestyle change for the owner, isn't it?
Yes.
Yeah. It's not just, I need you to feed a different food to your pet. It's, I need to change what you do every day.
Yes.
And I think sometimes we underestimate how hard that is.
Yeah.
For people to change.
I think people know it because they do it all the time themselves. And if I look at myself, you know, if I only look at my diet, it's not going to make any difference. I need to exercise, I need to walk, I need to do all these steps to
so we know that, and we also know we don't like it, and we know it's frustrating.
And so it's frustrating for us, so it's even more frustrating for the D and the cats, because whatever I do, they're still fat. Or what you very often hear is the fact, like, I hardly feed them anything.
Yeah.
And still.
Yeah. And in some cats, honestly, I think that can be fairly true. Like, the more obese you get, it seems to be the less calories it takes to maintain you.
Yes. And I think it's all about that metabolic set point, right? One of the things with energy restriction, one of the things that I've been wondering about is I often have that discussion with colleagues. When you calculate an amount of food and you restrict the animal for weight loss, do you drastically reduce the amount of food, or do you go there gradually?
That's a great question.
And I don't think, like in dogs and cats, there's not any research on this. But one of the things that is that I think is a problem with going gradually is that you change that metabolic set point, and every time you reduce it gradually, you have to restrict more to actually make sure that the body is reacting properly to it. You want to make sure that you create that negative energy balance. So we're going gradually, it might be more difficult to actually reach that negative energy balance and actually lose the weight.
But you know, the flip side of that is often, if it's quite a drastic change you have to make, it's easier for the owner to accomplish it if we do it in steps. So it's a bit of a conundrum, isn't it?
And one of the other things that I've been wondering about as well is with satiety, of course. If that animal is really used to a large amount of food or a large volume of food, and then all of a sudden you go to a tiny little bit, how will that animal deal with that? Right? It will,
and it may not be pretty.
Owner deal with it, because it's psychological. They say, I cannot feed. I mean, I'm starving my cat. And
the cats respond. You know, the cat's up on the counter looking for food.
I would be afraid for begging behavior as well. So,
which would be good because they would be walking a little bit more.
Well,
and more
maybe,
exercise.
But that's
I know one cat that was trying to eat through the bag of kibble and broke a tooth. So
that's not good. Yeah, but we hear these stories, right? So I've often wondered that too. So. And we have tried, especially with some of these really obese cats, we've tried to like step them down because it just seems easier for the owner to get on board. But now, you know, maybe in terms of metabolic set point, I'm not doing them any favors. Like,
well, and I think it's all about reaching your target weight loss, right? Following up over time and making sure that you reach that 1 to 2% of the initial body weight loss per week. So if you are below that, you have to restrict more. Right. Yeah, if you're above that,
which is not common in cats. Like cats, we're not usually getting above that. Yeah. And here's the other thing that I'm in terms of celebrating successes. So we'll often see owners who can we have a target goal, and we often see owners who can get partway to the goal, but not quite get all the way. Yeah. And even some weight loss is probably a benefit to the cat.
Yes.
Right?
Yes.
So I don't want owners to feel like, oh, you've only made it halfway. Oh, too bad. Let's, it didn't work.
You're a loser.
Yes. Well, but it was a good loser, right? So I think we have to reward that.
I don't think in cats there's any research on this, but I think in dogs, I think a study by Alex German found that I think it was 5% or 10% weight loss was already
significant.
Success. Yes. And they already saw changes or health benefits to these animals.
So it's not it's not an all or nothing thing.
Yes.
Right. So even if you can get some weight off of your pet, that's still better than nothing.
Yes.
Yeah, I think that's important because it is frustrating. And we should celebrate even little successes, right?
Mm-hmm.
Yeah.
So what is your plan of attack for a cat that's morbidly obese? Because we see sometimes these pillows come in that are so big. What do you advise?
And they don't move. move and they're hard to manage.
And like the first thing is really like, it's sad, but it's energy restriction, right? Like we have to reduce the amount of calories. It's all about the balance between energy goes in and energy goes out. So there's two ways of correcting that balance. One is making sure that they use more calories, so more activity, which in these morbidly obese cats is probably in the beginning is probably hard, or getting less calories in. So in those morbidly obese cats, it's really focusing on diet, making sure that they're not eating too much calories. And at the same time, they still feel satiated. So when it comes to energy, I do my calculations based on 0.8 times RER for ideal body weight. And I choose a diet, especially in these cats that are morbidly obese or that are eating in very big volumes. You want to choose a diet that is high in fiber.
So they can have a volume.
So you want to bulk them up, right? I think that's the first thing I focus on. And then even in the first weeks, if you see some success with that, that cat will automatically become more active. The moment these animals start feeling better, if there's some weight off of it,
then they'll start moving. Then
more.
we can start making them work for food. When we start a work for food, I call it my no free lunch. I think you and I have talked about this before. And so we'll often start with something that's very easy, like a very easy homemade puzzle. So the cat and the owner see success right away, right? And then, of course, we can increase complexity and add different toys. And cats will get into that. I have a colleague, Dr. Allison Cooper, who's shared with me a video of one of her old, overweight, arthritic cats who learned to use a food ball. Right? And because she's arthritic and she has trouble with her elbows, she pushes it with her head. And if that cat can figure out how to lose weight with a food ball and push it with her head, it's doable. And
those things don't have to be expensive, right? Like you can make a lot of things yourself at home. Like my cat was eating from an egg carton box.
That's one of my favorites. Or a muffin tin. My daughter uses a muffin tin.
It doesn't cost anything. You just put a couple of kibble in each hole, and then they're just playing with their feet to get the kibble out.
And it's a start, and it's some activity. Didn't cost the owner any money. Everybody sees it works right away. So I love things like that. They're really helpful to get things going, right? So what about other dietary approaches? So we talked about higher fiber ones for the really obese cats where satiety is an issue. But there's other approaches.
For cats, there's a couple of different approaches. However, I think the most important thing, no matter what approach you choose, is that it should be a veterinary therapeutic food for weight loss.
And why is that?
Because one of the things that we are afraid for is that when we're restricting an energy, you might also restrict other nutrients that are essential. So if you're reducing the amount of food, you're reducing everything, every nutrient, right? So when you would just go with, there's many clients that will ask, can we just continue with the diet that we're feeding? A pet store diet, it's maybe there's, on the label it says it's a light food or a low-fat food. Those diets are not intended for weight loss because they're not enhanced in whatever is essential. There's enough in those to keep an animal at a healthy body weight. But if you restrict the amount of food, there might be deficiencies in some essential nutrients.
And it might take time to see that too. It might not be immediate, right?
No. But I think what you will see immediately, like it's protein and amino acids, right? So you will see those animals that are overweight and losing muscle.
Or their hair coat looks horrible. Or
vitamins, minerals, essential fatty acids. This is very important, especially in cats, because they are at risk for hepatic lipidosis. And hepatic lipidosis is one thing is really they're obese, they're insulin resistant, that's a trigger. Restricting energy will trigger that, but there are a lot of amino acids and vitamins that play a role in that as well.
Hugely.
So I'm thinking about methionine, cysteine, amino acids, carnitine, choline, one of the B vitamins. We have done research at OVC using a veterinary therapeutic diet for weight loss. And even with that diet, we noticed that cats were not meeting their choline requirements. So if a veterinary therapeutic diet is already at the limits, I'm really worried that if you do a weight loss plan with an over-the-counter diet, that the risk would be even higher.
Worse.
And I also think that it is really important, once again, to emphasize the fact that the role of the veterinarian has in here in guiding a client and staying very much on top of this diet and all the changes that it can have.
Yeah, because clients don't know this, right? They don't understand any. They have no way of knowing.
And so a weight loss program, I mean, I'm convinced that also in humans, weight loss programs don't work if you don't have a dietary expert with you, helping you
a support system
to do that. And the vet is the role person here, or a good technician, because they are fantastic. But having this veterinary healthcare team support makes the success so much bigger and the risk so much lower,
especially for cats.
And that's why I'm a big proponent of veterinary diets too.
Makes a big difference.
Diets.
Just shows you how tough cats are, right?
But it's for every species. I mean, this is something that
I agree.
And with the problem that the cats have a little bit is the hepatic lipidosis and the risk there, because that's a death threat. I mean, it's not something we should just scam over, because they can die from it.
Yes.
If you do it the wrong way.
But if you do it right, you can prevent it, right?
Yes.
So you want to make sure that you follow up with the cats, do a regular body weight, body condition score, muscle condition score, making sure that the weight loss doesn't go too quick. It's difficult in cats, but if they're usually in those hepatic lipidosis cat, the weight loss went too quick.
It's quick,
And then usually it's because, it might not be because of the energy restriction that you did for weight loss. It might be because there's a reason that they stopped eating, right? So especially when you switch them to another diet, make sure that you keep track of that, right? Make sure that you are in contact with the owner, having them call into the veterinary practice if the cat doesn't want to eat the food. Because that's a very severe energy restriction.
And
that will definitely trigger
that's
the
where
disease.
your obesity clinic comes in again, because those people have the time to do it. And if they don't call you, you call them and say, how are you doing? How much eating? Helping them with the transition time too, because it's not like you put one diet away and the other diet in front of the cat. Because
what are your tips for getting diet transitions in cats?
So
it can be tough.
It can be tough, but typically, like, I do, like, depending on, I first look at the animal, right? I talk to the owner, trying to find out how finicky the cat really is, and have they had problems with switching diets in the past?
Because they aren't always. But some are.
And then depending on what I hear from the client, I will go with either a 7-day or a 14-day transition period, gradually switching out.
Do you put food side by side?
Yes.
Do you mix?
I don't mix. I like
side
the
by side. Yeah, I do too.
And I think if we really want to keep track of food intake, it's very, like, I like the owners to actually, like, I like gram scales.
Yeah, me too.
So
better than volume.
Every pet owner should be using a gram scale, especially when it's about treating weight loss.
I totally agree.
So when you're following up with food intake, it's much easier to, like, if you're weighing the food and there's leftovers, weigh the leftovers, and you can keep a much better track. Well, if you're mixing the foods,
you can't.
It's not as easy to follow up, right, with that. Just put the two food bowls next to each other, and let's hope that the cat will actually or you could do it, offer the new food first, see if the cat eats it. If she wants to eat it, let her go. If she doesn't eat it, offer the other food.
I find meal feeding helps too, because if the owner just leaves food out all day, versus if we start to switch to meal feeding, when you offer food, the cat's probably hungry, right? And may investigate the food. The other thing I talk to owners about is that cats have some behaviors around food that they might misinterpret, right? So with the new food, some cats will go over, they'll sniff it, they'll eat a bit, and then they'll walk away. And it doesn't mean they hate it. No. It just means they need a little more time.
And you don't need to change the meal.
Right.
I mean, that's it, because they're like, oh my God, I need to get another variation.
That's what people will interpret.
That's it.
So I think we have to alert them to things like that.
Since you're talking about meal feeding, in relation to obesity, feeding more meals has been shown to increase activity in cats. So that could also help. Multiple small meals could also help with treating.
And that helps with the tools that you use, because you don't dump the whole you
better
give
control,
a little bit,
better monitoring.
But it also takes time, and a lot of people don't have time. So I'm not going home 5 times a day to feed my cat.
But a lot of people can fit even like 3 times a day into a work day.
Yes,
you know, a lot of people can.
Yeah, I think most people can do that. Like you give a meal at breakfast when you come home from work, and before bed. I think everybody can do 3. If you're home at lunchtime, you can do 4.
Yep. Or a timed feeder could give you an additional one.
Yeah.
So in people they say you should not eat before you go to bed, but in cats that's not an issue. Then
never really thought about that.
Yeah.
To be honest.
Well, remember, cats often hunt in the dark, so it's probably more normal for them to eat in the dark than us, right? You know, sort of evolutionarily.
And I think humans probably overeat.
That's the thing.
That's probably the problem.
So you don't see cats at McDonald's every day.
I hope not.
So to finalize this wonderful session, because we're almost at the end, any news on diet pills, the magic pill that we can give to a cat?
No.
Well, because some drugs have been tried, not cat, but dog.
Dog have been tried. But I think in the end, no matter what pill, it can be really helpful to maybe jumpstart that weight loss plan, like in animals that don't, and that's how I saw the drugs that were marketed for dogs as well. Right. If you have those animals where it's really difficult to get the weight off, you can get them started. You see an immediate success, but in the end, it's the lifestyle change that is needed. And if the drug may help, but if the owner goes back to feeding the same thing, not being active, the weight will bounce back on, right?
Yeah. That's a good point.
No magic pill.
No magic pill.
No, sorry.
No, this has been wonderful. So
lovely.
Thank you so much.
It's amazing how fast the time goes, right? We're talking about
crazy.
something we love. So we're really grateful that you spared some time for us today. Thank you.
Fantastic, and good luck with the obesity clinic.
That's
really cool.
Yeah, and all the research you have underway. We'll be very excited to see what happens. Great news.
So thank you.
Thanks a lot.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatPetSusan. Dr. Yola Kerpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast.